While this comes up, good morning, everyone. First of all, I must thank the organizers, Yashoda Hospital, and everybody behind this conference. Wonderful conference, and it's amazing to see such a relevant topics being discussed here, and so much of progress being made already in this space. Excuse me, it's not coming up. So, in next few minutes, we'll try to focus on what we call as edge AI. As we all know, edge AI typically means the use of intelligence at the edge of the connectivity chain, right? Or in other words, it's the use of intelligence where the value is being delivered or where the information is being generated, right? So in next few minutes, let's look at what's going on in this space in general and what's required and where we are heading. Now, the first and foremost question is, in the era of connectivity wherein we can find Wi-Fi everywhere or we have 5G and 6Gs being promised, where does this edge AI stands, or why do we even need that, right? Because we have such a powerful cloud over there. Can we just not do this? Why we need to really bother about having an intelligence on the personal devices, on the medical instruments, or whatever the instruments that we are looking at in hospitals, etc. Now, if you really look at what's happening is the architectural shift, not just in the medical space, but everywhere. There are a lot of challenges that we have seen in the cloud space, and a lot of us talked about the DPDP Act in the previous session also, and yesterday as well. The privacy becomes a lot more important nowadays, right? You are talking about your heart rate data, your blood glucose levels, your, whatever data that you have, which is very private, and you don't want that to leave your premise or a device, right? So privacy becomes very important. The next very big issue is the latency. We'll see in the subsequent data that I'll show, the latency becomes very important, right? Because if you look at cloud, you are talking about more than 1 second of latency at least, if not more, right? The other thing is the connectivity part, right? Even though we say we have a highly connected, 5Gs or the 6Gs of the world, we can't really rely on it all the time, right? So connectivity, privacy, latency, cost, right? We have seen that the cost of using tokens is so high, companies are running out of it, right? There is a lot of cost that's in right now. The offerings beyond Anthropic, I don't know if anyone is making money yet on the offerings, and so the cost becomes a lot, right? And when we are talking about end mile health delivery, you don't want to pay for your tokens as you go, right? So the cost is another challenge that we see in case of cloud-based solutions. Now you look at the edge, right? You are talking about your AI models running on the device itself, right? For example, if I have a personal health monitoring device, the network, the algorithm is running on my device itself and making the inferences that are needed right there and then. It doesn't need to go back. So the cost is almost zero. You just pay for the hardware once, and then you don't have runtime cost. A huge saving. Energy, right? You know the cost of running data centers. It's very high versus cost of running a very specialized use case is a bit low. Reliability, performance, latency, all that is taken care of if it's running here. Privacy, we talked about it. Data doesn't leave your device. And then personalization, very important again, right? I am very different from the gentleman sitting next to me. Can the device adapt to my needs and requirements and then give me that intelligent value proposition? And that's what comes in. Just a peek on the cost, right? The cost economics, if you see the cost per query is going up, and with the number of users increasing exponentially, I think it's very difficult to expect the data centers to scale up to deliver the value that's required, right? And we have just started. I mean, I don't think we have seen the use of AI yet, which we are talking about in terms of medical devices, personal devices, and all that. So the cost at this moment itself, the demand is outstripping the supply. So the future of AI is hybrid, right? What do we mean by hybrid, right? Now, depending on the use cases, you may have to decide where the inference, or which means the intelligence, should run, right? We are looking at multiple models wherein heavy passive or non-latency dependent use cases can still go to the cloud and run. But if there is, let's say there is a device which is monitoring my heart, and it is predicting that in next few seconds or minutes there's something going to happen and it needs to inject something in it. In those scenarios, the intelligence should run on the device itself. You can't take a risk of latency or connectivity and all that. So those kind of use cases should be brought in onto the device. Now there is something in between which we call as edge server. A hospital like this can run a edge server which can also connect with the devices which are within the premises and provide a high value compute or a use case running on the edge server. So it doesn't need to go onto the cloud, it's local, but then the device may offload that to this server because the device may have a limitation. So we are looking at various scenarios in which you would have the runtime decision on where the AI load will run, right? Certain cases will run just on the device, certain will run in combination with edge server, and certain use cases you could go back to the cloud for the AI processing. And therefore you will see all these models being worked upon. Because in case of, let's say, you take an example of a robotic surgery, right? And the surgeon is sitting behind, surgeon is somewhere, remotely located. In those cases, the latency requirements we are talking about is like 1 millisecond and less than that. So in those kind of scenarios, the edge server becomes very important. And then it can certainly assist the surgeon. The AI engine running on the edge can assist surgeon in terms of surgery as well. The three pillars for this whole edge AI solutions we are looking at is in terms of connectivity, compute, and sensing, right? So if you really look at all the kind of use cases or the devices or what's happening, I think it's typically these three. And what's happening in this space is, if you really see where the device manufacturing industry or the component manufacturing industry is going in, the lot of research is going into the development of efficient hardware, right? What do we mean by efficient hardware? As I said, your edge device will run the use cases. Right now we are working on a device for visually impaired, and hopefully it will be out somewhere in the next month or so, wherein it can give it can look at the surroundings and help the person to navigate by itself, among many other things. But the key use case there is live guidance when he's walking on the road or thing, where the latency becomes utmost important, right? So in those scenarios, the AI engine, which is doing the analysis of the video stream that's coming in, is actually running on the smart glass that's being built. Now imagine the complexity of the processing required, the battery requirements and all of that, right? So all that needs a very efficient hardware that can basically run such a complex neural network on the device itself efficiently, because you need it to last longer as well. That also requires algorithmic advancements, because the algorithms or the models that are running on the server, you cannot expect them to run on such a shorter constraint environment as it is. So a lot more innovations have to go there, and tweaking goes there, right? The software tools are the other aspect of it, because you need the developers or manufacturers of these devices to kind of get the right tools that can basically fine-tune it and allow the use cases to be built. So these three are the key areas in which you would see also the decisions. How you make a decision on selecting a particular component should also be based on it. Now let's look at some of the examples. I'm sure you might all be familiar with this. One of them is like wearable patches, right? Wherein you would have a tiny machine learning network continuously running to evaluate different signals that are coming in, right? Whether it's, you could, in this example, this is ECG signal, you could think about multiple signals in terms of whether it's glucose, whether it's, cholesterol level, or whatever indicators that body can give you, right? So it's basically sense all or reads all these signals runtime, make an inference, and make a prediction about what's coming next, and make a curative action based on that. Glucose monitors, we are already seeing it, wherein you will, the device or the patch or the instrument that's connected to your body will monitor the glucose levels and predict like at what level or at what rate the glucose levels are going down, and will inject right medicine at the right time, right? Intelligent respiration trackers. Again, basically, these are these look at the runtime, signals, run the algorithms to isolate lung-related symptoms, and take a curative action there. Now, this is very huge market or need that we will see. You see in Japan, you see in Europe, the society is moving towards, the average age of society is moving beyond, it's basically getting older. Even in India, you see there is a lot more, you don't find personal caregivers for people who really need it. I mean, I know someone who's really struggling to get a person to take care of a person who cannot leave the chair and is very, very much dependent on somebody else. And, the help leaves like in a couple of months, and, it's so challenging for them also. So this is a very, very important market wherein some of these use cases wherein delivery of medicine, raising alarm or prediction of something failure or fatal event that's going to happen are becoming very, very important, right? Even in India, we are seeing that old age care is becoming a lot more important. So this segment that we are talking about in terms of edge AI is going to be hugely important there. Silicon innovation, which is happening, you'll see today we have 45 TOPS NPU capacity running on the phones and the edge devices, right? The silicon which I talked about, which is going in the smart glasses, is basically running at this level. Heterogeneous on-device compute, microwatt standby states, these are all the innovations coming in to reduce the power. Some metrics just for the comparison about traditional cloud versus edge AI. If you see the latency, you're talking about 2.5 to 5 seconds in the traditional cloud versus in edge AI, we are already seeing less than 30 milliseconds. Similarly, offline functionality is provided by edge AI because you have everything running on the device. Security, again, there is inherent zero trust architecture that's being implemented, wherein it becomes difficult to hack it because your system is running on the device itself and does not communicate with the cloud and other network entities. And bandwidth also, because you're talking about tokens moving and high amount of data moving. If it's local, it does not generate any additional data. Another use cases that we are seeing coming up, yesterday somebody talked about ambient clinical documentation. Very important use case. You could do that on the cloud, but again, as I said, there's various regions have different data protection acts coming in, so it becomes very, very critical private data. You cannot even afford a single lapse. So edge AI becomes a very important solution there. Clinical advisors, you have distilled medical LLMs which are running locally, which assist physicians to assess what's going on and then deliver that. Real quick, I'll just show what's the prediction of the latency levels. And lastly, I just want to say that the future of healthcare is not logged inside a centralized cloud database, but it's going to be a cooperative network of intelligent point of care instruments which will protect the privacy, reduce delays, and democratize the clinical mastery. So, thank you.